Okay, so good morning, everyone. My name is Pauline, and I will be the moderator for today's presentation. I wanted to cover a few technical points before we start. You should all remain on mute for the duration of the presentation. If you unmute yourselves, I will mute you. So please make sure to stay muted, and we'll not be taking questions during the presentation. If you do have questions after, you can email canhrmail@canhr.org. And we will be posting a recording of this presentation on our website if you want to share with other people after the presentation. And that is it. I will turn it over to you, Tony.
Pauline, just want to make sure we're recording.
Yes.
Okay. All right. Good morning, everybody. I have to say I've done a lot of webinars in my time, but never anything quite like this. First of all, we're using Zoom for the first time ever. So I hope this works in this format. Second of all, I don't think I've ever given a webinar where I've been less prepared. And it's not like we haven't thought a lot about this subject in the last few weeks, because it's pretty much all we've thought about. It's just that there's a lot of uncertainty, a lot of frustration about what's going on and what the right thing to do is, particularly for residents in long-term care facilities. We're going to do our best to share with you the information that we have that we think is important for you to know about. But please keep in mind that with regard to all of this, there's just a ton of somewhat scary, completely frustrating uncertainty about what is right and what is wrong. All the laws and the rules that we've relied on, all the processes that we normally rely on are, some of them are, we don't know if they apply right now. Others are, do apply, but have some elasticity that they didn't have before. So we will do our best. We solicited questions in advance. We're going to try to address, and we got a lot of them. Thank you. We won't be able to address all of them. We tried to incorporate some of these into the presentation, and then so you'll see them brought up in the slides, and then I will reference them as we go along. But before I begin, I really wanted to say, despite all the uncertainty that's going on, I think the rule of being reasonable is still completely applicable right now. So even though there's a lot of variables to what's right and what's wrong, what's reasonable and the fact that people are required to act reasonably is still very much in effect. So we'll go into what I think is reasonable approaches related to different topics, but you want to continue to do the things that you would normally do. If you have a problem with a long-term care facility and what they're doing or not doing for your loved one, then you do the same things you would normally do. You address that to the facility, and you try to resolve it, and you try to work amicably with the facility, understanding that they're in a very difficult situation, a situation that was kind of inconceivable just a couple of months ago. If you're unable to resolve it informally, then you utilize the Ombudsman program. The Ombudsman program is still operational and taking complaints and trying to address complaints and resolve problems. If that doesn't work, you can try the licensing agencies. In nursing homes, it's the Department of Public Health. They're still taking complaints, they're documenting them, and certain complaints they're inspecting and investigating right now. And if that doesn't work out, then you go into a writing mode. You write your problems down and you send them to the facility. If it gets to a situation where you've tried to resolve it informally and using the other organizational resources, and it's not working, then I think it's time to address it in writing. And you're doing two things when you address it in writing. One, you're letting the facility or the other party know that you're very serious about what's going on. And I think that usually written complaints get more of a serious response than a verbal complaint. The second thing you're doing is you're documenting that there's a problem. Because I think when all this settles down, if there's a situation where a facility was being unreasonable and a long-term care facility resident was harmed as a result of being unreasonable, they can still be held very much accountable for the consequences of that. So I think all of the things that you would normally do, you continue to do, and you call CANHR if you have a significant problem. You call CANHR and we will try to help you resolve it. And it also, all of the calls and the questions that you have inform our advocacy, because we're doing a lot of advocacy right now at the federal level with CMS and at the state level with the Department of Public Health And it's really helpful for us to know where the sticky points are in the delivery of care. Okay, so just a real quick bit, if you're on this webinar, you know about CANHR most likely, but I just wanted to let you know, generally we do 3 broad things. One is we help people related to Medi-Cal benefits for long-term care, particularly nursing home care. We deal a lot with elder abuse and neglect, and we have a lawyer referral service for elder abuse and neglect that's still operational right now. The third thing that we do is primarily deal with consumer issues, consumer complaints from family members of consumers, and we try to resolve them, and a big part of that is doing policy-related work. That's really important at this time. I want to mention, as part of the crisis, we've really had a couple of iterations of our work in the last few weeks. At first, we were real concerned about visitation, and we will discuss visitation here, and possible neglect of residents as a result of the loss of visitation and the restrictions on communication and observation of residents. Then we started transitioning into worries about staffing. We thought that there would be significant loss of staffing potentially with the family visitors for sure, and then also with caregivers being held out of work because if they show symptoms of having any sickness or having to deal with their own children because the school's not being open. Then the last week or so, we've been very concerned about COVID-19 coronavirus getting into the buildings. Residents coming in from hospitals with a positive test or with symptoms. That's a significant concern for us, and we'll talk about that in a slide coming up. And then the last couple days, we've been hearing about nursing home residents being moved out of their nursing home en masse to some non-nursing home setting, like a empty school or building, to make way for COVID-19 residents. And we don't have any example. Well, we're very concerned about that happening in California. That may be happening in some other states as well. Okay, also, I guess I should start by introducing myself. My name is Tony Chicotel. I'm a staff attorney with California Advocates for Nursing Home Reform. I've been a staff attorney for a long time, 14 years now. And I'm also joined by our newest staff attorney, Mike Dark, who's been really awesome during this time, tracking all of these big concerns related to the coronavirus. All right, so nursing, just 101 on long-term care. Nursing home versus assisted living, we sent this invitation broadly, and there may be some of you who don't really know the difference. The key is nursing presence. Nursing homes are required by law to have nurses in the building at least 8 hours a day, registered nursing, and some nursing, licensed vocational nursing, 24 hours a day. Nursing homes are big, typically. Minimum 50, 60 beds, can go up to several hundred beds. Usually have the name rehabilitation or healthcare center or wellness center in the title. Assisted living facilities, if it's a single family dwelling, boarding care home of 6 residents or fewer, that's definitely assisted living. Some of the bigger assisted living facilities kind of look like nursing homes, but if almost all assisted living is paid for privately. So if the resident or the resident's family are sending the facility a check every month, chances are very good it's assisted living. And when we first set up these webinars, there was some significant differences between nursing home and assisted living as it relates to COVID-19. That's kind of changed over the last few weeks, and there's a lot of significant overlap. We're doing an assisted living focused presentation at noon. So hopefully if you have a resident in assisted living or assisted living concerns, you can join us at noon. All right, so let's start with the substance. So the first thing we were really concerned about when the COVID-19 broke out was visitation. And we saw nursing homes limiting visitation in significant ways, barring who could come in the building or requiring that people who came in the building observe certain protocols. And that rapidly developed into almost essentially a ban on visitation in nursing homes. Now you see at the last bullet point is the CMS document, the memo that talks about permissible visitation restrictions. And you'll see there's an exception for compassionate care situations, like if you have a resident who's on hospice or at the end of life, they should be allowed visitors as long as they observe the infection control protocols and hand washing, they're just interacting with the one resident, and they're wearing personal protective equipment, the PPE stuff. And then you'll see there's exceptions for medical and governmental personnel who need to get in the building, infection control people, Department of Public Health, inspectors, people like that. So in light of the visitation restrictions, facilities should be making significant effort to accommodate visitation through other methods. And there's a lot of technology that can enhance visitation. I'm sure that a lot of you experienced this yourselves personally over the last several weeks or months, or several weeks, going on the iPad and using FaceTime, Skype. I've been using Google Duo to talk to my family members. Nursing homes should be making efforts to do this. Now, I'm very concerned that they're not, and I've been hearing from some of you that they're not. And this is one of those things where you would advocate in a way that you normally would pre-coronavirus. You would raise these concerns to the facility. If you can't get them resolved, you bring in the ombudsman, you bring in the Department of Public Health, and then you start writing this stuff down. Hey, I'm a person who visited with my mom or my grandfather once a week, and now I'm not able to do that, and I need to be able to do that. So please accommodate me. And then you start the back and forth in writing and see if they can come up with something reasonable. When all this ends, hopefully sooner rather than later, if you've got clear attempts to develop accommodations for visitation and the facility was not going along with you, I think there's going to be consequences for them. And now every facility is different. Every facility is going to have different capacities in terms of accommodating visitation here, but they should be making every effort. I've been hearing a lot about nursing home staff that continue to just spend time on their phones and not providing direct care. If we find out that there's a facility that had staff members who were just not providing the care that they should have been, and there was resources available to spend on visitation accommodation that they weren't doing, I think we're going to be able to hold them accountable for that. Nursing homes should be trying everything they can to put you at ease that the care in the facility has not suffered as a result of the coronavirus. They should be providing information to responsible parties. The responsible parties should be providing that information to the rest of the family. My advice, so we did get a question about family members being sort of left out of the loop. If the facility is communicating with a responsible party who doesn't see it as part of their job to communicate with the rest of the family, what can you do? I think that in that situation, you raise it to the facility. You say, hey, look, even though I'm not technically the responsible party, I did visit regularly. And I observed how care was being provided on my visits. I deserve to continue to receive information about how care is being provided and how my mom, how my grandfather, how my loved one is doing. Even though I'm not able to visit, I'm not a responsible party, you need to accommodate what I once had, which is observation and peace of mind. And again, we invite you on this to call CANHR and let us know what you're seeing, and this includes, if you think a facility is doing a great job related to accommodating visitation, we would like to hear about how that's happening so that we can tell policymakers and tell other facilities what's working. Okay, as a result of the visitation restriction, obviously there's a huge loss of oversight that causes a lot of concern for us. The bottom line here is to be very vigilant. How can you be vigilant when you're not actually in the building? I think it's communicating with the facility, communicating with your loved one, if that can be accommodated. So vigilance and communication, I think, are the key here. I suspect that there's not a lot of facilities who are communicating with family members to let them know how their staffing levels are. But those are questions that you should definitely be asking the facility whenever you have concerns. Hey, is there any shortages in your facility as a result of staff members being held out for being sick? How are you replacing staff members who aren't able to show up for work? Those, I think, are all legitimate questions to ask, and if they're not being answered, then put them in writing and demand that they respond. So this is just another slide that kind of goes back to what I was talking about before. Use the processes that you would have normally used. Complaints, the ombudsman still has a lot of value. Department of Public Health complaints still have a lot of value. Calling CANHR and letting us know still has a lot of value. Do all of these things. I think another option that is not on this slide that is particularly more available now than before is the media. There's a ton of media interest in what's going on in healthcare facilities during the coronavirus. And a lot of that interest is in nursing homes. So if you have a situation where you think the facility is not being reasonably accommodating or reasonable in any other way, call up the local media. The television stations, the newspapers are all doing stories on this stuff, and they may be able to put some pressure on facilities to do things a little bit differently than they've been doing them so far. So we have a huge concern about COVID-19 positive patients coming into the building. And this is an evolving, very fluid situation. As of right now, you cannot go on the internet and find out which nursing homes have COVID-19 residents in the building. We're hoping, did you want to say something about the COVID-19 in the building?
Yeah, this is definitely a moving target. And part of the trouble here is that states have delegated a lot of authority to county departments of health in making decisions about this. And what we're hearing so far is that different counties are taking different approaches, which is not good for patients and it's not good for their families. We are advocating very strongly that California enforce a prohibition on sending COVID patients into facilities that are naive to the virus. We don't know if that will be successful, but minimally residents and their families should be insisting on notification if that does happen.
Yeah, absolutely. So there's no way to find out if a facility has it. This is from the Department of Public Health that facilities should be informing. This was an email exchange we had with them. I don't think they put this in anything formal. That facilities should be informing the residents and their families whenever there's a known infectious resident in the building. There's no requirement for that yet. Now we're pushing for that, but we haven't had success yet. I want to mention a couple things here. With visitors not allowed, ombudsman not going in the buildings, DPH for the most part not going in the buildings, I think it is clear to facilities that this is an unparalleled threat in our recent history. So facilities are on alert that this is a very serious threat to the residents in the building. If they accept a resident with COVID-19, they had better be prepared to make sure that no other residents are infected with it as a result of that admission. And if that happens, then I think there's going to be consequences for that. They're well aware of the liability. And part of this is an informed consent issue as well. The moving into a nursing home and staying in a nursing home are healthcare decisions, and we have lots of cases that say that. As part of that health decision, you want to know the risks and the benefits and the alternatives to that decision. And I would say that having a COVID-19 resident in the facility is a significant risk to all the residents' health in that building. And that information should be communicated to every resident and every resident decision maker in that building so they can make informed decisions going forward about what to do about it, to make sure to ask questions about the facility's quarantining of those residents, whether they have enough PPE to protect the staff, to protect the other residents, how they're going to prevent that infection from spreading inside the building. And if they don't get the right answers that they want, then maybe talking about alternatives to staying in that facility. The question, can nursing homes refuse admissions? We think that they absolutely can in this very, very unusual circumstance. A lot of the laws related to readmission, I think, are in suspension right now. So they can refuse readmissions the way they normally can. There's laws that say that facilities can't take residents for whom they cannot provide good care, and there also has to consider all the other vulnerabilities of the other residents there. Can hospital patients refuse placements? That's a big question. Right now, hospital beds are a premium. Can hospital patients be picky about what nursing home they go to? I think absolutely they can be. And if they have real concerns about being placed in any particular facility that they don't think can protect them, then I think they should raise those concerns. will they be able to dictate where they go? As much as they've been able to ever dictate where they go from a hospital? I think the answer is sort of yes and no, unfortunately. So coming and going, we've got a lot of questions about residents leaving the building for a short period of time and then returning. On this, again, you want to be reasonable. Facilities have more leeway than they had before to limit where their residents go, given the fact that there's this pandemic out there. So you want to limit it to essential outings. We had some questions about what is essential. Is picking up a check, an income check, is that an essential outing? Well, I hate to give a lawyerly answer, but it really depends on things. How essential is that check to that person's well-being over the next couple of months? Is it something they could wait for? Is there an alternative way other than a check to get the money? What about doctor appointments? Well, again, it seems like doctor appointments may be by definition more essential, but it depends on what kind of doctor appointment it is. I think dental appointments right now are not considered essential. A chiropractor appointment might not be considered as essential as other appointments. We've also had some questions about post-outing precautions. So when the resident comes back into the facility, what is the facility able to do to prevent introduction of the virus into the facility? We heard of one situation where the resident was asked to go into a room and strip out of their clothes and have their clothes put into a bag so that the bag, the clothing wouldn't come into contact with anything in the building. Was that reasonable? Well, it depends, I think, on a lot of circumstances. One thing that we think is absolutely reasonable is to expect that the facility is going to communicate these sort of limitations and these policies in advance to residents so that they don't have to decide whether they're going to stay as a resident in this facility or not on the fly. So all these kinds of things, we're hoping that these new policies that facilities are coming up with are communicated to residents as soon as they're adopted. Longer outings, you'd probably definitely want to stay away from. We had other questions about forced isolation, and this came up prior to coronavirus. I remember assisted living facilities that would have outbreaks of norovirus or stomach flu that were real severe, and they would force the residents to stay in their room 24 hours a day. So they take their meals in their rooms. They weren't allowed to interact with one another. Again, I think it all falls into what's reasonable or not. I think that residents' mental health and psychic health are important considerations here. Their ability to interact with other people is an important part of their quality of life. But if there's an active open outbreak in the facility, then I think isolation might be part of the considerations for what the facility should do to protect all the residents in the facility. And then if they're going to impose an isolation into the room, then I think there's going to have to be some accommodations there. They're going to have to provide them with activities to do so they're not just stuck there like a prisoner. So that leads to this very important, prior to this, rarely considered option of bringing someone home when they continue to need nursing home care. And we don't have the answer for you. I think this is a very, very highly personal kind of formula. I don't think people should be too concerned about bringing someone home unless there's a known outbreak in the facility. Other people may have different opinions. If you have the capacity, or if your family has the capacity to provide good care at home, then this should absolutely be considered to bring them home. I think the most significant con here, assuming that you can provide the care that the resident needs, is what's going to happen when this is over. People may have time on their hands that they didn't have before because their job, they're laid off, or they're working from home and they only can do so much at home that they could do before. So what happens when things start clearing up, and how does this person, are they going to be able to go back to the facility, or are they going to be at risk of not getting enough care in the family home? These are all really important things to consider, and I don't have the answer, but I do think people ought to be thinking about this. Maybe some people think that it's better to not wait for an outbreak to happen, given the lethality and how quickly this seems to spread within the nursing home context. part of this might be communicating with your nursing home or your facility to make sure that they have good protocols in place to make sure that it doesn't spread. But who knows what's going to work and what's not going to work. Mike, do you have anything to add here?
Only to say, Tony, that if people do take the route of making a complaint to the California Department of Health, the regulator of nursing homes, understand that right now the department is focused like a laser on COVID and infection control issues. And if you complain about just about anything else right now, you're going to get very little play. However, if what you're seeing or hearing from your loved one in a facility is that there are infection controls, there are staffing issues that are apparent to the resident or to you through a window even, that's the kind of thing that will get you some attention if you bring it to the attention of the state.
So real quickly, we've had a number of questions recently about document witnessing and notarization. Just to bring you up to date, the California State Legislature did present the governor a proclamation that I don't believe he has signed yet that would allow e-signatures to be notarized. And I don't know all the bells and whistles of e-signatures, but that would hopefully free up some residents of facilities that are sort of in a quarantine mode to be able to sign documents with a notary. There's other ways to do this. There's a lot of documents that don't require a notary that require two witnesses. We get a lot of questions about advanced healthcare directives. The ombudsman can still sign as witnesses if they're able to witness and work with the facility to get, the resident at the window to sign, or maybe the resident can, and I've been a big proponent of this, using video. Everybody's got phones and iPads that can record video, record the resident signing the document, and then show that video to a prospective witness, and then they can sign as a witness. Another option here is to just sign without witnesses, and I think that's better than nothing at this point. You can have the resident sign, this is what they want, this is who they're naming as their agent, without the witnesses, but we still have some evidence now that would potentially guide healthcare providers in the future that this is what they wanted. And, given that the crazy circumstances that we're living under right now, they may give some more leeway to honoring that document than they would have before without the witnesses. There's other options related to healthcare instructions. Probate Code 4711. Probate Code 4711 allows patients to make healthcare instructions in advance, or to appoint a healthcare surrogate in advance, and the medical providers have to document that in writing, and that can last for the course of that facility residency. There's also POLSTs, which don't require witnesses. You have to have a physician sign a POLST, a physician order for life-sustaining treatment. So that's another option. So the bottom line here is just be creative, and getting a signature or one witness versus two witnesses is better than nothing. So I wouldn't just say, well, forget it, we can't get two witnesses or a notary in this situation. Have them complete the documents and sign them, and then you can worry about the witnesses later. Okay, and I'm real sorry that we're not able to go into a ton more detail. I wanted to keep these webinars very short so that people could access them on the internet and at least get some answers to some questions, and then any unanswered questions they can raise to us directly. You can give us a call on our toll-free number. We have an internet web form that you can fill out with your questions or concerns that will be routed to one of the advocates to be answered, or you can email us directly at the CANHR email address. All right, I think that's it. So as Mike was saying, if you're going to do a complaint, I think it's real important, if you can, to mention any infection control concerns you have, or to frame it as an immediate jeopardy situation, especially if you're not getting any peace of mind that the staff in the building are adequate to meet the needs of the residents. We're hearing a lot now that the expectations are that in many facilities in the state, there will not be sufficient staff to meet the needs of the residents, even without COVID-19 in the building. That's highly concerning to us. If you have any situations like that, please report them to the Department of Public Health. Use the term immediate jeopardy to trigger their hopefully on-site presence so that they can confirm or verify the short staffing on their own, first person. And please let CANHR know so that we can track this stuff. And every day we are shifting and moving our advocacy to where we think it is, where it best serves residents. And every day that changes, and we're trying to be as responsive as possible. And it's all fueled by the concerns that you raise to us and let us know about that are happening in your community. Mike, anything else you want to add?
No, I'm good. Thanks, Tone.
Okay. All right. Well, thanks for participating. Yeah.
Sorry, I just wanted to add, if people want to log on to the presentation at noon, go back
Yes.
to the same announcement, and there will be the link for the presentation at noon.
Okay. All right. Thanks a lot, everybody. Stay safe, stay healthy, and be well.
Thank you.